Okay, good evening everyone. This is my assigned report, which is the relationship between working memory and mental practice in stroke patients. In the study of stroke patients carried out by the researchers in Canada, Maulin Belleville, Richard Rosas and Doyon 2014, the verbal, visuomotors, and kinesthetic domains of working memory capabilities were compared to the effectiveness, the combination of physical and mental practice for stroke patients with motor impairment on one side of their body, or let's just say the hemiparesis. It simply says that the verbal and visuomotor and kinetics, this is the three domains of working memory, which is it has the capacity nga motabang sa isa ka stroke patient nga maayo ni with the combination of physical and mental practice for those patients nga adunay daot or one side of their body was daot or na stroke. These three will help them to get things back to normal. And also, to cure this illness, or let's just say nga maayo na, they had to undergo the motor practice, which is the stand and sit, and had to undergo the monitor practice, which is the stand and sit task. Kung unsa ang makaya nga force sa isa ka patient, maura say makaya nga ma-deliver niya nga force sa iyang leg. The same sa other parts sa iyang body nga naapektuhan. Also, it helped the patient to recover the part of his body if he or she will be doing the motor performance. Pareha ra gud na sa ang gamit. Kung dili nimo siya magamit, di ba maluma na? The same as sa kung dili na to ma-exercise ato ang body, parts ato ang body nga stroke. Di ba makalumpog ta kadugayan. Mo nang kung mahimo everyday jud kung ikaw isa ka stroke patients, everyday gid ka maglihok-lihok para rapod sa imong mga parts sa imong body nga ma-energize rapod sila o dili kaya sila mabulok. Next page is, according to standardized tests found in Strauss in 1998, working memory test experiment presented as a series of items that each patient had to produce immediately in the same order. These tests are verbal, visuomotor, and kinesthetics. And this working memory have the three domains, which is the verbal, visuomotor, and kinesthetic. For the verbal is the list of 2 and 3 common use and is easy to imagine memory monosyllabic words. For visuomotor is experiment taped on a series of 9 blocks randomly. For the kinesthetic is experiments produce a series of gestures that involve unilateral and bilateral lower limb movements. So, naghatag sila og sa working memory is naghatag sila og kanang scenario, which is the patient sat on the chair with each foot in the force plate. They were instructed to stand without using their hands until they heard a tone and then sit down. They were shown a computer monitor the amount of vertical force that was overloaded in the unaffected leg and told to try to reduce that amount while increasing the amount on the affected leg. Well, the result of it was the amount of improvement on the motor performance task was related to the patient's working memory capabilities. Patients with higher visuomotors working memory score showed a greater amount of performance improvement. Patients who have impairments on at least 2 working memory domains had smaller amount of motor task improvement and demonstrated no lasting improvement on the retention test. While they have also test from physical and mental practice, which is during a familiarization training session, patients performed the motor performance task and were asked to verbalize how they plan and executed the task. Practice involves a series of 5 trial blocks of 1 physical practice trial followed by 4 mental practice trials, during which they closed their eyes while seated and imagined they were standing and sitting. They indicated to the experimenter when they began and ended trial. So the result of it was the patients improved the amount of the force in the affected leg during their standing up and sitting down after just 1 sessions of the mental practice combined with the physical practice. This improvement was maintained 1 day later on in retention test. Also, they have the cognitive hypothesis, which is the researcher generally agree that the first stage of learning a motor skills involves a high degree of cognitive ability. And it's surprising which is this activity is related to questions about what to do, which this new task. It should be surprising then that mental practice would be an effective strategy for people acquiring a new skill or learning on an old one. Mental practice can provide the person's answers to many performance-related questions without the pressure that accompanies physical performance and the skill. In the later stages of learning, mental practice can be beneficial in assisting the person to consolidate strategies as well as to correct errors. And also, they have the mental practice and imagery ability. Although researchers have proposed both psychological and psychological reasons for the effectiveness of mental practice for learning and performing motor skills, related factors also might be operating. There is evidence indicating that the effectiveness of the use of imagery as a form of mental practice is related to a person's imagery ability, which is the ability to imagine an actions when requested to do so. And also, this evidence demonstrating that imagery ability is an individual differences variable comes from the researcher using tests of movements imagery such as the movement imagery questionnaires or MIQ, a test of imagery ability designed specifically to apply to motor skill performance. Evidence demonstrating that imagery ability is an individual differences variable comes from research using tests of movements imagery, such as the movement imagery questionnaires or MIQ, a test of imagery ability designed specifically to apply to motor skill performance by Hall and Marty 1997, Hall and Pongrock 1983. As a recap, an ability refers to a relatively stable characteristic that indicates a person's potential to perform skills in which that ability is an important component. In this study, the researchers selected people who were categorized from their MIQ scores as a high visual, high kinesthetic, or HH, high visual, low kinesthetic, or HL, or low visual, low kinesthetic, or LL. Before each practice trial of 4 complex arm movement patterns, participants kinesthetically image the movement about which they receive instructions. And an experiment by Lovell and Collins 2002 addressed these questions by recording electroencephalograms or EEGs at various brain sites for males who were classified as a high or low movement imagery according to the MIQ. And thank you for listening. That would be all.